Good. So this is TMI with Mark and Troy. We've got a very special guest with us today, Dr. Kevin Bloyer. We're excited to have you with us. Thanks for joining us.
Well, thanks for having me. I'm excited to do this with you guys today.
I came prepared with some notes. So Dr. Bloyer was born and raised in, I'm not going to be able to pronounce that correctly, Odebolt, Iowa, as the fifth of 7 children. Big
Correct.
family. Graduated from Odebolt Arthur High School and went to Iowa State University to complete his pre-chiropractic program. Upon reaching the required credits and classes, he attended Logan College of Chiropractic in St. Louis, Missouri. Dr. Bloyer was the president of the Adjusting Club. We're going to hear more about that, I'm sure, while in school, and graduated magna cum laude in 2009. That's pretty incredible.
Yeah, it is.
He is now a chiropractor at Bloyer Chiropractic and Wellness, which he opened in March of 2010. Dr. Bloyer lives in Ankeny with his wife, Tiffany, and their 4 children, sons Everett, Levi, and 2 daughters, Nora and Cecilia, who we were just talking about the kids a little bit ago. He enjoys many outdoor activities such as camping, boating, fishing, grilling, and much more. And he also loves to travel and spend time with his family, and I can attest to that. I do know that that is something that's very important to you, spending time with family. I am one of your patients, so I will sing your praises. There was a time and a place years ago when I come back from a business trip, and man, my knee was just out of place, and it was probably, which I didn't think about chiropractic when I was talking about my knee. I had gone through all the steps to go to an orthopedic surgeon, and they had done all their X-rays and I think a CT scan and some other stuff, and they're ready to cut me open. And you were like, "Hey, do you mind if I just do a couple of adjustments?" And the next day it was fine. I'm like, I almost went and had surgery because I wasn't smart enough to know that there might have been another way to tackle this. So you always take care of me, and I appreciate it.
That's awesome. Was that a ski trip?
No, that was actually, we were 4-wheeling up in the mountains. And
Okay.
I also played some basketball. I was up there. I don't know which aggravated
It's
it, but something
basketball.
did. Probably.
all the above. Yeah.
Yeah, I shouldn't be playing basketball anyway. All right, well, we appreciate you joining us today. We would really like to hear a little bit about your background, how you got into chiropractic, what kind of motivated you to go that direction, and then we'd love to also hear about how chiropractic can help the folks that we serve, folks who are near or in retirement, and helping them stay mobile and active, so they don't lose that mobility as they age.
Yeah. So my story starts way back in middle school. Had to write a paper on what I wanted to be when I grew up. And from a small child, I knew I wanted to be a doctor. That was just the easy answer. I want to be a doctor when I grew up. And had to write a paper in 8th grade English. And I chose chiropractic just kind of randomly, to be honest, and had to research it. And then I had to cite my sources and do all that. It was that type of paper. And just learned more about chiropractic and about how you use your hands. And there's no drugs or no surgeries, and helping people that way. And it just kind of stuck, I guess. And so fast forward into high school, I was in a car accident, saw our local chiropractor after that. Then fast forward, I was in a football injury, or I had a football injury on a Monday, and I thought, no way am I going to play on Friday. There's just no chance. Saw the chiropractor a couple times that week, played on Friday, and I just really kind of opened my eyes to, hey, maybe there's some truth to this. I've seen it in action. It's helped me. And it just never really changed course from there. So all through high school, it was chiropractic. I went to college, met with my advisor. I said, chiropractic's what we're doing. How do we get there? And basically just was focused on that. I only took the courses I needed to get into chiropractic school. I didn't do anything else. And so after 3 years at Iowa State, my then girlfriend was graduating, but I wasn't. But I was able to go only after 3 years, and then got into chiropractic school and did it from there. So nice. So that's kind of how it happened with me and my story. Nothing too wild and crazy, but just kind of had a path in mind. And I always say it was definitely a God thing, just kind of laid the foundation, and it was there in front of me. And thankfully, no big road bumps or anything that kind of got in the way. And very thankful it happened that way. So in regard to your clients, and how they can benefit with chiropractic, there's a lot of people during the retirement. When something I like to talk about with my patients, I say, when you plan for retirement, you don't want to have your money run out when you're 70, but you live to be 100. And I said, right. Your financial advisor is going to say you don't want to outlive your wealth. That's an important thing. That's why we have you guys. But I also say you don't want to outlive your health. You don't want to live to be 100, but you're not moving at 70, because then now getting in and out of the car, taking a shower, going to the gym, traveling, being with family. That's all difficult if you're not moving. And so the very essence of chiropractic is to ensure that people are moving as they age and maintain that mobility. That is by far the very basis of what we're trying to achieve.
Yeah, I can't agree more. I mean, we stress financial health, but also physical fitness. That's a big part of both of our lives, staying mobile and staying fit, because what's the point of having a lot of financial resources if you can't use them?
Right.
Mm-hmm.
Yeah, and you're just kind of stuck and can't really get out and do the things you really want to do. And most folks, they're retiring sometime in their early to mid 60s. Some work longer, some get to retire earlier, depending on how well they planned for it and what their lifestyle looks like. And everybody's circumstances are different. But for most folks, you start getting into that, 60 years of age, 60 to 70, your mobility is still okay, but you're not 40 anymore. And by the time you reach 70, you'll really start to see that decline, and your options for activities start to decrease. And so it's really important that you keep your mobility and be able to do things with your family, your grandkids. And
Absolutely.
Yeah. Well, what does a typical day look like in your practice?
I was thinking about this the other day. What is a typical day in our office? We kind of do the same thing with everybody, but it's always different, which is awesome. So I truly love what I do. If you come in as a patient, we can talk about a ski trip or where you're traveling or how work has been going, how the family's doing. And then the next person that comes in, they've had a terrible work week. And so we can talk about that. And it's just, the physical part of what I do is similar, but just the conversational part of it can be different. But a typical day in our office, we have a lot of patients that come once a month. So we try to preach wellness care. Take care of your body now, even if you're not hurting, get a regular adjustment. Similar to going to the dentist for a cleaning or getting an oil change. It's just to maintain things as you age. And so we have a lot of patients that come in and they're smiling, they feel good, they get adjusted, and they leave smiling and hopefully continuing to feel good. But we also have varying other degrees of patients that come in. Someone could come in with a raging migraine. Someone could come in with low back pain or knee issues or shoulder issues. So there's a lot of different things that will dictate what we need to do. A new patient, for example, someone that's never been, we spend an hour with our new patients. So when they come in, we sit down and we talk about why they're there, their history, car accidents, other issues they've had. If they've been to a chiropractor, surgeries they've had, we cover all that. Then we do a pretty thorough examination, which includes range of motion testing and postural analysis, neurologic testing, orthopedic testing. So we do these things with them. We go over it with them, and then we do their treatment. We cover insurance, all the information questions they may have. And so that visit is a lot different than Mark coming in just to get a monthly wellness adjustment. So sometimes people come in for car accidents, and that changes our paperwork. It changes everything that we need to do. But the gist of it remains the same. When somebody comes in, we want them to leave moving better, feeling better, and functioning better when they go. And then it can be different, from person to person as far as when a follow-up is needed and other things too. So generally, our days are never the same, but the basis of what we're doing, kind of stays the same from patient to patient.
Yeah. What are some of the misconceptions? It seems like, I think it's progressed more. It seemed like 20 years ago you mentioned something to your doctor like, hey, I'm going to see a chiropractor. And it was almost like, what are you going there for?
Yeah.
What are some of the misconceptions maybe in the chiropractic care?
So backing up 100 years, people were getting arrested for doing chiropractic. So we've come a long, long way. With insurance coverage, almost all insurances have chiropractic built in now.
That's nice.
I joke, if you have an old geezer for a doctor, they're probably not going to think of chiropractic on the first, musculoskeletal diagnosis on a treatment level. But the newer doctors are much more on board with it. So newer PAs, nurse practitioners, doctors, they were kind of born and raised, like you said, in the last 20 years. There's been a much bigger push and appreciation for chiropractic. So the younger doctors really are more in line with that. As far as misconceptions, the big thing that I tend to hear that is just not true is potentially being unsafe when somebody gets adjusted. And if you look at the data, of all the healthcare providers, chiropractic has the cheapest malpractice insurance of anybody. And if you look at the data from the insurance, they're not losing money. And so if they're charging us less than other providers, it's because we don't have the claims, we don't have the malpractice issues. And there's always an inherent risk with anything that you do. But patients that come in and say, you know, I'm concerned about my neck getting adjusted, or I'm concerned about this or that, I remind them that it was more dangerous for them to drive to my office that day than to get adjusted. And so we're very much trained to try to identify things that would make an adjustment unsafe. Or the other day we turned away a person because their blood pressure was like 260 over 190. And so we were like, you need to go, this is your priority right now, you know? Yeah. And so we don't just have a person come in, lay on the table and crack their neck. There's a lot more to it than that. And I think as the medical world learns, you know, that we've been trained for that, you know, I always joke that I have no interest in hurting a patient. It hurts me and it hurts them, you know, it's bad. So, you know, another misconception is that we have to pop the neck. And I have a lot of people I meet in the community or in my office even that, you know, they say, I'm worried to go to a chiropractor. I don't want to go because the thought of you cracking my neck just scares me, gives me nightmares or whatever. And we have a tool called an activator. So it's a little adjusting tool that we can use to adjust them. I've seen it work on people thousands of times. And there's no twisting, there's no pushing, there's no popping. I can do it around surgical sites. I can do it in other areas where it's very, very safe. And once I kind of show them that and explain it to them and know that we can tailor the adjustment to make them comfortable with it, usually that veil drops and they're a lot more open to trying it. But they just didn't know. You know, they watch AI videos on Instagram and there's people getting rocked, you know, on there, right. And that's not a typical day in our office at all. So videos online can be a little misleading sometimes, but there's also some good ones out there too that help, you know, people see some of the things that we can do. And so I'm not opposed to Instagram videos about chiropractic, but sometimes I do think I wonder what people are, you know, what their impressions are after they see some of those.
Yeah, the old online stuff can be good and bad. Like you get diagnosed with something, like, well, what does this mean? You go online and like, oh my gosh, I should have never looked at this.
Oh yeah, that's the worst.
Dr. Google can be a good thing, but most of the time it's not.
Like, should never look.
You want to raise your anxiety level? Go searching about that pain you have in your side. And all
you know, one thing we were told in school, we were told that you know, if you hear hoofs coming towards you, it's probably a horse. It's probably not a zebra. You know, and when you get online and you're looking up those symptoms, usually you're looking at all the zebras. And that can be scary, but most of the time you got to keep it simple. So
that's a great analogy.
Yeah.
Well, you mentioned that as things have come a long way, insurance has really gotten on board and started to cover chiropractic. It's pretty much, you know, across the board. If you've got insurance, you probably have chiropractic care coverage. A lot of our clients are transitioning from their workplace healthcare plans onto Medicare as they age. So how does Medicare interact with chiropractic care?
Great question. So Medicare, it's kind of broken into a couple of different scenarios. So there's the Medicare Advantage plans, and then what I call regular Medicare, usually with a supplemental plan. So the regular Medicare has been around a really long time. It's actually very favorable for chiropractic. And a lot of people, when they come in and we go over their benefits with them, they're pleasantly surprised at what's covered with Medicare. So for some reason, chiropractic, the exam is not covered. It is with your medical doctor, it is with your physical therapist, it is with anything else you're doing except chiropractic, which is strange. So hopefully that'll change. And you know, if we get legislatures, you know, educating people on that, maybe that will change someday soon. But the exam is not covered for whatever reason, but the adjustments are covered very, very well in comparison to other insurance companies. So typically with a regular Medicare plan, they cover 80% of the adjustment. And then that 20% typically goes to the supplemental and it's covered by them. So a lot of our Medicare patients that come in for active care, and I'll explain that in a second. For active care, they don't pay anything out of pocket for the adjustment. Now, active care is when you come in for a problem. And typically with Medicare, there's a lot of rules I don't need to get into, but for an active problem, activities of daily living need to be affected in some way. So you're not sleeping, you're not mowing the lawn, you're having a hard time getting dressed, putting a bra on, things like that. Yep. So how is this neck pain or headache or back or shoulder, how is it affecting your mobility routine, you know, and it's affecting your day? Once we start getting this patient feeling better and functioning better, there has to be a time when we draw the line and say, okay, you're as good as we can get you or you're completely fixed. Then we recommend that, you know, a regular adjustment can help keep you this way. Medicare doesn't pay for that. Okay. So we have some patients that will do that. They come once a month and they pay for it out of pocket. Then if they fall or they slip and they hurt themselves, then we can go back on Medicare for that. So that's with the regular Medicare. With the Advantage plans, they also, I know there's a lot of different opinions out there with the Advantage plans. What we tend to see is a copay. So when somebody comes in, the exam again is not covered, but they might have an $18 copay or a $20 copay, depending. There's United Healthcare, Blue Cross, Aetna are the three main ones that we see, and so they just have a copay that they can come in for. And some of the rules are a little bit different, but most of the time it holds true that if you're under active care, you can submit it to your insurance. But once you transition to that wellness care, then we can't, which is true for regular Blue Cross, United Healthcare, Aetna, and the regular plans too. So they do kind of fall in line with most insurance companies as far as that's concerned. For the most part, though, people are usually very pleased with what's covered when they come in and don't have a huge out-of-pocket expense.
Nice.
Good. That's great to know.
It is. Any favorite patient success stories?
Oh, yeah.
I know, Mark, as a patient, when you have a knee problem and then the next day you're feeling good, that's huge for someone that's active especially. But do you have any favorites?
So probably my favorite, because it happened so early in my practice, but this was probably 13 years ago. I had a young lady come in. I forget her age exactly. I think she was 11, and she had been jumping on her trampoline. Everything was fine. She was jumping on her trampoline, and then everything was not fine. She couldn't walk.
Oh, man.
And so she would walk with one leg and then very almost grotesquely with the other. And you could definitely tell something was wrong. It wasn't like she just hurt. She was not walking with normal gait, not even close. And so they went to, and I don't mean this in a bad way to anybody, but it's just the path that they took. They went to their medical doctor first, and then they were a pediatrician, and then they were sent to a physical therapist. Nothing really changed. And physical therapy is great. I don't mean this, like I said, to be taken the wrong way. Just in this instance, she needed chiropractic. So she went to PT, no help. They went back to, ended up going to a pediatric hip specialist. They did MRIs on her. They did x-rays. They did more PT. They did, multiple stops with no answers and no help. And they were talking about surgery with this 11-year-old girl. And so they kind of came in. I met a neighbor at an event, and the neighbor talked to her neighbor back home, whose daughter was the one in question. And so they ended up coming in kind of as a last resort, like, what do we have to lose? Right. And so we did an exam. I actually shot an x-ray on her. I don't normally shoot x-rays on an 11-year-old female, but with this case, there was just enough evidence there. I wanted to see it, and so we looked, and her sacrum was rotated, and I measured it and talked about that with the parents and how that can really affect the pelvis and the gait and other things. And I recorded her walking. I put tape on her legs and just watched her, go down and back. And we started our care, and there was nothing miraculous. It's not like I adjusted her and she ran out the door. But I told them it's going to be a slow, steady change, hopefully, if we see it. And so 2 weeks later, I think we did 3 visits a week for 2 weeks. She walked in, and I said, she's walking so much better. And the mom was a little bit like, yeah, I don't know. I saw some change. Well, I pulled that video up that first day, and the mom was like, oh, I had no idea. It had happened so slowly over the last couple of weeks, she didn't even realize how much better her daughter was walking. But then I sat there and thought back to, the surgery thing. What were they going to do? They weren't finding anything on an MRI, nothing on an x-ray. This was a structural issue that just needed to be helped so that she could just walk normally. That when she walked, she was irritating the hip and irritating the pelvis. And, I don't know what they were planning to do, but that was the next step, because they didn't have any answers. So there's definitely a place for chiropractic in that regard. And MDs and pediatricians are great. PTs are great. But just in that scenario, this girl needed adjusted. And so that was awesome for me starting out to see, that chiropractic is something that can truly change someone's life. That way was really, really awesome. And so I thank God that just our paths kind of crossed that way and allowed her to, ultimately function better and just not have to think about her legs or anything anymore after that walking.
Awesome. That's a great story.
It is.
Yeah, I was thinking the same thing. What are they going to do? Cut you open, and then what? Like, what's the action, and what's the end result? I was probably a week away from having my knee operated on, which, once you go down that path, it's a one-way street. Yeah. You're going to have more of those later, most likely, as that wears out.
Yeah.
That's great, man. I love it. Big believer in going this route before we start getting the knife open. Yeah.
Oh yeah,
or
that's
getting
like
the knife
the
out.
last
No
resort
offense
for
to
me.
any surgeons out
Yeah.
there.
No.
Surgeons cut.
And
What they
that's a
do.
great point. I always say chiropractic first. So if you're having a musculoskeletal issue, chiropractic, PT, massage, acupuncture, those are all things that you can utilize first.
Yeah.
So many people think that surgery is this end all be all. If I could just have
Mhm.
surgery, everything's better.
Yep.
Everything will be fixed. I'll be playing basketball again if I just have
Yeah.
surgery. And we should be telling people that you don't want that unless you need it. And usually you'll know when you need it, And so if you're trying everything and nothing's helping, then you've tried everything. But chiropractic, PT, those what we call conservative care modalities, those are great things to start with because it's cheap, it's easy. There's not a lot of risk involved, so why not? As far as do a couple and see. Then from there, you learn and you have more data.
You mentioned the acupuncture. Is it like the dry needling? I mean, I'm hearing more on the dry needling. What is the?
So dry needling, they really target more specific like muscle knots and things like that.
Okay.
It is different than acupuncture,
Okay.
but very effective. And it's kind of a new and up and coming modality that people do. Some chiropractors do it. A lot of PTs do it. And it's a great thing. If you've got a stubborn knot muscle,
Yeah.
and we've even sent people away saying, we're adjusting you and doing muscle work. But sometimes dry needling is just, it adds a little bit more to it. So it's a great thing.
So what would you say are some of the most common mobility concerns for folks as they're aging, thinking your mid-60s and later?
So the easiest way or the easiest answer for that would be arthritis. Okay, so this word, and I like to kind of play with people a little bit when I talk about arthritis. So I'll ask you, who gets arthritis? This is what I do to a patient.
Old people.
Old people. That's the
right.
answer. Thank you, Mark. That's the answer. So we always say old people, and old is a naughty word in our office, but that's beside the point. So old people get arthritis, right? So what I really strive to educate people with is you don't get arthritis from age. You don't turn 70 and it's on your front doorstep. It's not like it just happens. And when we shoot an X-ray on somebody and C2 disc and C3 disc and C4 disc are beautiful, but then C5 is shot, I ask them, how much older is C5 than C4? If C4 is beautiful and C5 is really reduced and there's arthritic changes there, how much older is it? It's not. It's the same neck. It's the same age. So right there, we back up and say arthritis is something that happens over time. So age is a part of the process, but you have to have the step one and I'm talking osteoarthritis, not rheumatoid arthritis or psoriatic or those other inflammatory ones. So just to be clear, but with osteoarthritis, you have to have misuse or overuse to start. Then if you misuse or overuse a joint, eventually the cartilage starts to get worn down. And as the cartilage gets worn down, then you develop the arthritis. And it has to go in that order. So arthritis is kind of the end stage of a problem that's been going on for a very long time. So always, 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 I say when you're younger, the more you start doing something about it now, the less arthritis you'll have later, which is why that's why we preach wellness care, the once-a-month care with chiropractic. It's not for pain. It's for arthritis and keeping the joints moving properly. And so starting sooner than later is always good with chiropractic. Doing things to help your joints, your body is always good to start earlier than later. But just making sure that things are moving symmetrically is kind of the key. And that's what we focus on chiropractic is, if you come in, your pelvis is rotated or your L4 is shifted, it's locked up, it's not moving properly. We need it to move properly. If it's not moving properly, it wears that disc down, it chews it away, and then you get the arthritis. And so too many people, I feel like, they sit around and wait. And then they're saying, okay, now what can I do about it? And you can't reverse the arthritic change. So it's important to do something earlier than wait around. And so to answer your question, doing chiropractic care can help keep people mobile as they age. But then also there's a lot of exercise programs. There's yoga, Pilates, and other things they can do. Our bodies are designed to move. We want to be moving. The synovial joints need movement to pump that fluid in and out. Your lymphatic system needs movement to move kind of the garbage system of your body. That's how you get rid of all the crud and the crap. And so movement is very important, but it needs to be the right movement. If you're off balance or you're asymmetric and you're a runner, well, you might, if you're a 200-pound person, you could put 110 pounds into your right leg and 90 pounds into your left leg, and then you're running a half marathon. that's going to create issues over time. Maybe not right away, but over time. And so the sooner you're taking care of that and thinking about the right type of movement and then staying mobile as you age is just key. And I like to point out that you can look at a 75 or an 80-year-old and you can tell the ones that are usually more mobile, the ones that have been staying mobile, they like to be active. And you can really, unfortunately, tell the ones that haven't taken care of their body or haven't been mobile. And so that's something that we need to teach our kids, especially with cell phones and computers and everything. It's hard to get them outside and get them mobile, but they need to learn that that's an important part of aging gracefully is, to be moving and moving the right way.
Yeah, you talk about mobility and actively. There's a lot of active people playing pickleball now. That's the new thing. My wife's got me hooked on this thing. And it seems like even at my age, like 1 week I got tennis elbow, the next week my left knee tweaked something, and then bottom of my foot's hurting the next morning when I get up. It's like we get up in the morning, sometimes I feel like I'm, nothing against 70-year-olds, but I feel like I'm in my 70s. I'm like, what are some of the things that because it's starting to really come on, and I see all different levels of ages. Like I can see from young to well into their retirement playing the sport. How do they stay mobile and stay where they're not getting these injuries or trying to prevent them?
So I'm going to jump ahead a little bit. I try to educate patients. People come in with injuries all the time and say, how can I stretch myself out of this? Or what stretches can I do? And my answer is nothing now. You should have been doing this before. So core strengthening, stretching, and things when you're well is really important to help prevent problems later. And so, again, from a chiropractic standpoint, I want you to be as symmetrical as possible when you're out there playing pickleball. So when you are with the lateral movements or you're bending forward or you're doing things, the more symmetrical your body is, the less likely you are to irritate something, okay? And you bring up a good point with the tennis elbow. There's a difference between a tendonitis and a tendinosis. So a tendonitis is you went out and played a tournament and you really just irritated, you overused it.
Yep.
So rest, ice, it feels better. It just was mad, you let it calm down, and it's better. A tendinosis is more of you're using it wrong. So you go out and play pickleball all weekend and it hurts, so you rest and you ice, you give it time, it feels better. And as soon as you go out there and play again, well, now it's mad because you're using it wrong. Okay. That's when you need to seek treatment for it. So that's kind of a nice little nugget as far as like, do I need to be doing chiropractic or PT for this or, something else? It's, in what mechanism do you feel that pain? And so again, backing up, if you're doing core strength, I'm really big on core strength. I think core strength is probably more important than stretching, in my opinion.
Okay.
Stretching, if you want to increase range of motion and work with that, I think it's a fine thing. But warming up is more important. Working on your core strength ahead of time, to me, is more important. And so, not just going out there and performing. And that's with any sport. It's warming up, short, graceful movements, kind of build yourself up to it. And then you're less likely to create issues. So static stretching. So, just pulling on a muscle and holding it. There's some data out there on either end of the tendon. There's something called Golgi tendon bodies. Their job is to prevent you from ripping a muscle. If you stretch a muscle too fast, they'll contract the muscle so you don't tear it.
Okay.
And what some of the data has shown, if you static stretch, so if you push your calf against the floor or you lean to the side and hold it, you're pulling on those Golgi tendon bodies and they start to tighten the muscle up actually, because that's what they do. That's a reflex. And so you could go out there with a muscle that's a little bit different than what you originally started with. That's where I say warming up is much better. So if you're playing pickleball-like movements are a good thing, but do it like short, small movements and then kind of build yourself up to bigger movements, that type of thing.
Okay.
And so, so waiting until there's an injury, not a fan of stretching after that, but a lot of things you can do ahead of time to just make sure that you're in a proper spot, if that helps answer the question.
Yeah, perfect. Thank you.
But actually, both of us go to the gym pretty regularly. I focus most of mine on weight training, not powerlifting by any means, but just weight training. Yeah, and I've seen a lot of, I guess, I don't want to call it research, but folks that fitness influencers and stuff like that, talking about the fact that the static stretching before you work out is actually counterproductive. That's something maybe you do afterwards, but warming up is more important. Then do your workout and then do the stretching after, but stretching beforehand. And actually, maybe you can address this too a little bit, but the fascia, the what goes over the muscles and loosening that up prior to workouts as opposed to going in and stretching.
Yeah. So the fascia is something that we talk about a lot with patients, and you can say scar tissue, you can say fascial adhesions. There's a lot of things with that. So in my office, we do adjusting, hands-on adjusting and instrument adjusting. But a big thing I do that I feel like is different than some others is that I do a lot of muscle work. And so I specifically do, it's called the myofascial release. And so myo being the muscle and then fascial being the fascia. So when you misuse a muscle or a ligament or the joint, you can create what are called fascial adhesions. And you can say scar tissue. I like to say fascial adhesions because it makes more sense. But these, think of it like little spider webs within the muscle and around the areas. And as this fascia, if it starts to adhere to other areas, then all of a sudden you start pulling on those other areas, and you're using the complex of the muscle or other things around it, the joint, in an incorrect way. And so when you have bad form, for example, and you go to the gym and you're lifting weights, you could be creating fascial adhesions, which in the moment don't really cause much problem. But then later, that's the person that all of a sudden develops the tendonitis, or all of a sudden it's tennis elbow, or all of a sudden my calf started, kind of my knee started bothering me. Yeah. And so, again, our regular chiropractic care, when you come in, I'm trying to look at you as a whole and see where are the joints that we need to work on. Are there any fascial adhesions that we find, and address them then? We stretch them out and work on them. And so that's a way to kind of help prevent then future issues. Sometimes you like foam rolling, doing some of the body tempering, stuff like that can help with breaking up some of that fascial adhesion too. Sure. So there's a lot of things that are not chiropractic that you can do to help yourself in that regard too. At the gym by yourself, It doesn't cost any money. It's easy to do that.
Well, that's something every time I come in for a wellness visit, if there are areas like that, you always been good about helping release those either fascial adhesions, or sometimes it's just knotted muscles that are preventing, they're causing issues. Otherwise, like I'll come in and I'll have something going on with my neck, but it's actually something in my bicep somewhere that's actually triggering it. It's just it's amazing how your body, all the parts are connected, and it was something that's completely in an unrelated area. You don't think like, why would my forearm have anything to do with this pain in my neck? Right. But you release that and you get those muscles working and functioning properly, and all of a sudden my neck starts popping and I'm back to, normal. And it's quite remarkable how the body can heal itself when it's working properly. Well, you mentioned a couple of things about those little things that the improper use over time, asymmetrical movements that over time can lead to really, really nasty results. And it made me think about, when somebody comes in and first is working with you, you have a diagnostic process that you go through to really figure out where is the root of the issue. Like the pain might be somewhere else, but where is it coming from? And our PT5 retirement planning screening process is very similar. We put everything under a microscope and try to really figure out where are the problems. And oftentimes we'll find things that are seemingly insignificant. Maybe you're like, oh, that's not that big of a deal. And there might be several of those that are seemingly insignificant on their own, but compounded together over time can be create either nasty outcomes later on, manifest into something really ugly, or there should be missed opportunities that didn't materialize because we didn't pay attention to them. I think in your field, it's so important to pay attention to those little things now, as opposed to waiting until they become immobility issues and then come to you and go, hey, I'm ready to go. I'm ready to go under the knife. Can you help me now? Years, Like, I wish I would have started this 10 years ago, as opposed to waiting until I had that big problem.
And it's funny how chiropractic and what you guys do in the financial world really parallel each other. Like finding those things in the beginning, learning how is this going to affect this person down the road? How do we maximize benefits or results? And then, doing all the things, all the steps in the middle to make sure that happens. It's really kind of wild how that lines up like that.
A lot of similarities there in the health and wellness space and the financial planning space. And I'll be very specific in the financial planning space. Oftentimes, Troy and I battle with this constantly. Folks, they hear we're financial planners and they go, oh, you're investment people.
Yeah.
Or they just associate it with selling investments. And I'm like, we help people do that when it's appropriate, but that's really not, It's the proper diagnosis of where you are today, how you'd like things to be in the future, and how do we get from is to how you'd like it to be, and what are the things that we're seeing, we're detecting because of our background and our understanding of how things work that you didn't even maybe realize could have been a problem later on, and then putting action steps in place. Not financial strategies or products, but putting action steps that can be taken to get us from where we are to where we'd like to be. And then when it's appropriate, if it's financial products or strategies, then we grab for those tools, just like you grab for, what'd you call it? The stenosis? What was that thing?
What, the activator?
Oh, the activator. Yeah. Once you've diagnosed it, you go, okay, this person's a little scared to have their neck adjusted. So we're going to use this tool instead, where somebody else who's not, you might not grab that tool. Once you've diagnosed it, both physically and psychologically, then you can say, okay, here's the right tool for that particular job. And there's a lot of crossover there.
Yeah, definitely.
It's cool. Troy, you have any other questions for
I don't.
Dr.
This has
Bloyer
been
today?
good. This has been informative. It's been good for me. I think guys are going to get good enjoyment out of this one.
Yeah, I do too. Yeah, and that's the purpose of TMI with Mark and Troy. We have a bunch of podcast episodes on our website that nobody wants to look at.
You have to listen to Mark and I tell you about
15-minute financial feast. It's all nerdy stuff, that we're interested in. But we want to create an environment and a listening and viewing opportunity to learn about folks in our community who are making an impact that our clients might be better off knowing exist or just knowing about. And we appreciate you coming and be a part of that.
Oh, absolutely. I very much enjoyed it. So thank you for having me. Hopefully people learn a little bit about what we do and hopefully debunk some of those misconceptions, but also just help people to understand that, just like with financial planning, you want to make sure you're doing the things now to help you later.
Right on. Yeah, absolutely. Yep. Cool. Thanks for joining us, everybody.
Thank you.
See you next time.